There are so many decisions to make with Medicare, including whether to choose Original Medicare or Medicare Advantage. So, which is better? Make sure to stay tuned to the end of the video for our final count. Hi there, as always, if you have questions about Medicare or health insurance in general, you can reach us in the comments below or at the number on the screen, and of course there is no charge for our services. So today we're going to be comparing and contrasting Original Medicare with Medicare Advantage to hopefully help you decide which is better for you. Make sure to like and subscribe to stay up to date. First, let's talk about benefits. So what exactly does Original Medicare cover?
Original Medicare is Part A and Part B. Let's discuss the benefits offered by Part A. You can consider this to be your hospital insurance because it will cover inpatient care in a hospital, so if you're actually admitted into the hospital. It will also cover skilled nursing facility care and nursing home care. Now, these are skilled nursing facilities that are designed to provide rehabilitative services and habilitative services after being hospitalized. They are not long-term or custodial care, so a condition like Alzheimer's would disqualify you from nursing home care because it is a long-term condition. Part A will also provide hospice care and home health care. Again, that's for recovery. Then there's Part B, which is your medical insurance and anytime a doctor is involved. Part B will cover medically necessary services and preventative services. So preventative services would be things like vaccinations or wellness visits. Medically necessary services are things that will help you to diagnose or treat ailments or conditions. It'll also cover things like clinical research. So if there are clinical research studies being done for your condition, then Medicare would cover that. Ambulance services, durable medical equipment. These would be things like wheelchairs, walkers, nebulizers, etc. It will also cover mental health services, both inpatient and outpatient, as well as partial hospitalization, and limited prescription drugs.
Now let's compare that with Medicare Advantage. So Medicare Advantage plans are offered by private carriers. However, they must offer at least the same benefits as Original Medicare. However, plans can choose to offer additional benefits such as dental, vision, hearing, prescription drug, and more to entice potential beneficiaries. But what do these benefits cost? Don't worry, we'll get to that later in the video. So as I said, Medicare Advantage plans are offered by private carriers, so those benefits really do vary. Let's take a look.
I'm on Medicare.gov comparing plans. Now, because Medicare Advantage plans are offered by private carriers, the plans that are available to you are determined by your area. So right now I put in a Florida zip code, and I do just want to make note that Medicare Advantage plans in Florida tend to be a little bit more robust than in other areas of the country. So if you don't live in Florida, you may notice that there's a stark difference in the plans available in your area, but that's one of the reasons that Florida is such a popular retirement destination. So there are different types of plans available. There are HMOs and PPOs. And of course, HMOs tend to have lower monthly premiums but less flexibility, so you have to stay in network, as opposed to PPOs, which offer you more flexibility. You also don't have to have a PCP or a referral to see a specialist. So here you can see some of the plan benefits. So vision, dental, hearing. This plan also offers transportation, fitness benefits, worldwide emergency, telehealth. It offers over-the-counter drugs, discounts on over-the-counter drugs. It also offers in-home support. It doesn't offer home safety devices or emergency response devices. And it does offer prescription drug coverage as well. Now, if you do take prescription drugs, you could add in your prescription drugs when comparing plans to see what your prescriptions might cost with that particular plan and make sure that it's covered by your plan. So this plan also offers similar benefits. If you want to look a little bit further, you could look at the plan details. Let's look at the benefits and costs. So here are some of the benefits and costs. Again, it has to offer at least the same benefits as Original Medicare. So of course, visits to your PCP, to your specialists, diagnostic tests and procedures, skilled nursing facility, inpatient, outpatient. Let's take a look at some more benefits. Drug coverage, as I said, these are the prescription drug coverage. Because we didn't put in any information for prescription drugs, there's no information being populated here, but it would show if I did put that in. Now, here's some of those extra benefits. A hearing exam and hearing aids are covered by this. Preventative dental, comprehensive dental, vision. Let's take a look at some more extra benefits. So these benefits listed here are some of the types of additional benefits that could be offered. As you can see, some of these benefits actually were offered. You could see in that snapshot from the previous page. Not all of these benefits were offered, but these are examples of some of the types of benefits that could be offered by your Medicare Advantage plan. And then there's even something such as special benefits. So chronic conditions, which could be covered by a C-SNP, which is a special type of Medicare Advantage plan, may offer additional benefits specific to that condition as well.
Now let's talk about monthly premiums. Monthly premiums are, of course, what you have to pay on a monthly basis to keep your insurance active. So what exactly is your premium for Original Medicare? Well, that depends.
So there are two separate premiums for Part A and Part B. For most people, you actually don't have a premium for Part A. That's called premium-free Part A, meaning you don't have to pay anything on a monthly basis to keep it active. Most people qualify through theirs or their spouse's work history. So as long as you've worked 40 quarters, which is 10 years, you or your spouse, then there is no charge for Part A. However, if you or your spouse haven't worked 40 quarters, then you would have to purchase Part A. And it would be either $278 per month per person or $505 per month per person. Now that depends on how long you or your spouse have worked. If you have worked between 30 and 39 quarters, then it would be $278 per month per person. If you've worked less than 30 quarters, then it would be $505 per person. Now, if you or your spouse is continuing to work, once you hit that 40 quarters, then you would at that point qualify for that premium-free Part A. Now, as far as Part B is concerned, there is a base monthly premium for Part B. In 2024, the base monthly premium is $174.70. However, the amount that you pay for Part B is actually determined by your income. So if you are someone that is a higher earner, you have a higher Part B. For an individual, filing joint, married but filing separately. These are the tax brackets and what your monthly premium would be. Now remember that Medicare is looking at your income from 2 years prior. And if that's the case, you might have been in a higher income bracket, but all of a sudden are in a lower income bracket and therefore would qualify for that lower monthly premium. If that's the case, you want to go ahead and file this form right here so that way you can have your Medicare premium adjusted.
And what about Medicare Advantage? Now, many Medicare Advantage plans advertise themselves as free. Are they free? Absolutely not. At the very least, you still need to continue to pay for Part B. However, many plans actually don't charge an additional monthly premium on top of that Part B monthly premium, despite the fact that they offer those additional benefits. Another cost that you need to be aware of with Original Medicare or Medicare Advantage is your deductible. This is the amount that you have to meet out of pocket before your insurance plan begins to contribute to the cost share. At that point, you're responsible for copays or coinsurance. So what is the deductible with Original Medicare? Well, it can be a little tricky.
Part A has a deductible of $1,632 in 2024. However, this deductible is actually applied per benefit period. You can think of that similar to a hospital stay. So let's say you had to be hospitalized for a knee surgery in the beginning of the year. And then let's say in October, you needed to be hospitalized to have your appendix removed. Well, even though that was in the same calendar year, that would be two different benefit periods. Now, if you do need to be re-hospitalized within a certain amount of time, that would still be within that original benefit period, so you wouldn't need to meet that $1,600 deductible again. See, you can see here the benefit period begins when you're admitted into the hospital and ends when you haven't gotten any inpatient care for 60 days in a row. So that's after you've been released, 60 days after that. The Part B deductible is much easier to understand. It's $240 once per year. That's it. Once you've met that deductible, you're responsible for copays or coinsurance.
Now for Medicare Advantage plan, your deductible is determined by your carrier and your plan. Some plans will offer a $0 deductible. However, your deductible can't be any more than that of Original Medicare. Now, when you actually use your insurance, you'll have a copay or a coinsurance. Let's take a look at Original Medicare.
Again, there are different coinsurances for Part A versus Part B. So for Part A, it's determined by the type of care facility and your length of stay. So after you've met your deductible for inpatient care, there's actually no coinsurance if you are hospitalized between 1 and 60 days. Now, should you need to be hospitalized for longer than that, then there is a copay. For days 61 through 90, it's $408 per day. Days 91 through 150, it's $816 per day. And then after day 150, you pay all costs. For skilled nursing facility, days 1 through 20, it's $0, 21 through 100, $204, and you'd pay all costs beyond 101 days. For home health care, there is no copay. Now for durable medical equipment, you pay 20% of the Medicare approved amount. That's very important because the Medicare approved amounts tend to be much lower than average or regular costs for some of these durable medical equipments or for medical care in general. And then for hospice care, there's of course no charge. Again, Part B is a little bit easier to understand. It's usually going to be 20% of the Medicare approved amount after you've met your deductible. There is, however, no cost for clinical laboratory services and no cost for a lot of wellness or screenings, such as outpatient mental health screenings, your yearly wellness screenings, also some vaccinations, etc.
However, you can choose to enroll in a Medicare supplement plan, also known as a Medigap plan. Now, these will step in to fill in those financial gaps of Original Medicare. So they will help to cover your deductibles, your copays and coinsurance, and they'll impose an out-of-pocket maximum. More on that in just a minute. So basically, you can pay an additional monthly premium to have almost or possibly all of your yearly medical charges taken care of. Now, for Medicare Advantage plans, it's entirely variable. Usually your copays or coinsurance to see your PCP or even a specialist, they're usually going to be pretty low. For prescriptions, if your plan does offer prescription drug coverage, then it's going to be determined by the tier of the medication. And of course, hospital charges are going to be much more expensive. But again, these costs are outlined in the terms of your plan. Now let's talk about an out-of-pocket maximum. This is the maximum that you might have to pay in your plan's calendar year for covered in-network services. So if you have extensive medical needs in a given year and you hit that out-of-pocket maximum, then your insurance carrier is going to pay the remainder of the bills for the remainder of that plan's calendar year for covered in-network services. Unfortunately, Original Medicare does not have an out-of-pocket maximum. So if you have extensive medical needs, you may have extensive medical bills. Unless, of course, you enroll in a Medicare supplement plan, which we highly recommend. Now, Medicare Advantage plans, on the other hand, do have an out-of-pocket maximum. Usually it's a couple of $1,000s, and this can save you so much money if you have extensive medical needs. Now, on the flip side, there is the issue of networks. Original Medicare actually doesn't have networks. As long as your doctor or hospital accepts Original Medicare, you can see them, and almost all doctors and hospitals do accept Original Medicare. For Medicare Advantage plans, there are, of course, networks, and they can be rather restrictive, which is one of the biggest downsides to Medicare Advantage. Many people report that they have to travel extensive distances to find a specialist or a hospital who accepts their plan. And this is absolutely unacceptable if you need serious or regular medical care. And there's also the issue of pre-authorization with Medicare Advantage plans. So, who's the winner? Well, despite the potential cost savings and extra benefits offered by Medicare Advantage plans, the clear winner is still Original Medicare. You simply cannot overestimate the restrictive networks and the issue of pre-authorization that comes with Medicare Advantage plans. So we would still guide most of our clients towards an Original Medicare with a Medigap plan. If you can enroll in a Medigap plan on top of your Original Medicare coverage, it's certain that you're going to receive really top-notch health insurance. As always, if you have questions, you can reach us in the comments below or at the number on the screen. And of course, there's absolutely no charge for our services. Thank you so much for watching and have a wonderful day. Bye-bye.
Before you go, make sure to check out this video if you want to learn more about Medicare supplement plans. Also, please make sure to like this video and make sure to subscribe as well. We'll see you next time.